Last year alone, over 10,000 drug criminals were convicted, and nearly $250 million of their assets were seized.
Is handing out pipes and needles enabling those with substance addictions or serve as a harm reduction to society?
Hey y'all, so I'm here to debunk this ridiculous piece of disinformation that I've seen not only on the right-wing outlets, but on the Shade Room, that the Biden-Harris administration is spending $30 million on crack pipes. They're not. Come on, y'all got to be smarter. Y'all can't believe that. And you can tell me if that sounds like $30 million in crack pipes. The purpose of the program is to support community-based overdose prevention programs. Syringe services, okay, syringe services. That's still not crack pipes, and that's not $30 million. And other harm reduction services. Where did you see crack at?
And now the Biden administration is rolling out a $30 million program that will provide addicts smoking kits. And according to those close to the project in Health and Human Services, these kits can be used to smoke almost any illicit drug. On its website, Health and Human Services says the purpose of this program is to support community-based overdose prevention programs, syringe service programs, and other harm reduction services. It goes on to say it'll help control the spread of infectious diseases. The president claims this program will promote racial equity. Applicants of underserved communities classified as either African American or LGBTQ will reportedly have their grants prioritized. Cities like San Francisco and Seattle already have programs that hand out smoking kits, but Louisville, Kentucky decided to ban smoking kits they once allowed to be sold in convenience stores over fears this would enable drug abuse. Maryland lawmakers scratched the idea of smoking kits after local law enforcement and African American leaders spoke out against it.
And so what they're saying basically is that they're going to be distributing drug paraphernalia, and that's what that money is going toward. But it's a lot more than just that.
It's part of it, though. I mean, the grant serves historically underserved communities, right? That's the nice way to say black people. And the underserved community part comes from the advanced racial equity funding. And the grant description requires the provision of smoking kits. But those kits do constitute just one of several things on a longer list for grant recipients. So yes, while the focus is on the outrage of crack pipes, that's just a small part of the program.
Now let me ask a question. This might sound stupid. How many people die from crack a year? Because crack is not one of those things that you hear people talk about. So how many people die from crack a year?
I have not.
Well,
have you heard people talk about dying from crack recently?
I don't know what your argument is. What's your debate here? Crack is whack.
In 2021, U.S. drug overdoses due to fentanyl skyrocketed and is now reported to be the leading cause of death for Americans aged 18 to 45. The leading cause of death for Americans between 18 and 45 is imported fentanyl, mostly coming across our open southern border. Instead of combating this epidemic by prosecuting drug traffickers or banning molecularly altered fentanyl substances, the Biden administration is making America's drug problem worse by actually putting crack pipes distributed into the hands of users. Crack pipes distributed by the U.S. government into the hands of drug users. Yes. This has been already modeled in San Francisco, so I guess we want to do the Californication of the rest of the country with these crazy ideas coming from the Biden administration. Boy, we've gone from just don't do it to, hey, just hand it all out.
So to my young friends out there, life can be great, but not when you can't see it. So open your eyes to life, to see it in the vivid colors that God gave us as a precious gift to his children, to enjoy life to the fullest and to make it count. Say yes to your life, and when it comes to drugs and alcohol, just say no.
As someone who counsels people who are addicted to drugs, what do you think about that move? And isn't it more of a setback for Latinos and minorities trying to get ahead?
Exactly. When I first seen it, I thought it was a joke. I don't know where the Biden administration is getting their advice from. Maybe Hunter Biden is giving them their advice. But to me, it's just a total shows the insanity of the Democrat Party. Like you said, I grew up in that lifestyle. So I grew up, I used to even do drugs and I was around people. So I know firsthand the devastating effects. They're just even to whole families, even kids growing up with their parents on drugs. I've seen people that overdosed, all of that. So what's next? Are they going going to offer to give them crack too next. That's going to be next on their agenda. Like, it's totally insanity. That's like a person wanting to commit suicide, and yet we enable them by giving them the bullets.
How can the federal government giving glass pipes and making, and they specifically say it, African Americans and the LGBTQ community members a priority? How can they justify this as advancing racial equity? I see it as the exact opposite.
And I almost feel like this is a trick question.
I know.
And so I know. So I understand the intent of what they're trying to do. They're trying to make sure that those who have addictions will get clean drugs to be able to be in society and to be able to contribute back through jobs, through being responsible American citizens. But this is kind of a slippery slope, because what we don't want to do is increase drug usage while at the same time trying to save people from drug usage. And so, I mean, I really don't even know how to handle this, but I would not say that it's something that will close the wealth gap in the Black community.
She said, to be clear, I recognize that parents, including me, should discourage drug use, but you should also know that my son wanted to get high, not die. And because this is the case for many young people, whether we like it or not, we should do all we can to keep them safe and alive. It's the humane thing to do.
Yeah, I agree with that, but I also agree that we should just try to keep them from not getting high, you know, and I wish they would focus on rehabilitation more and mental health services to help people get to the root of their trauma that, you know, might be leading them to substance abuse. Like, you know, that's just my personal opinion.
It hasn't increased drug use, and they said once that place Insight opened in Canada in 2003, they have not experienced one overdose the entire time they've been in operation.
Well, this ain't Canada. Let's see how it plays out. And I mean, by the way, this program has been around. It's not like this is something new, by the way.
Yeah, some cities do this already.
Mm-hmm. It just sounds wild. And it's easy to attack Democrats on this because this is an administration that hasn't done anything for Black people. So being that it hasn't done anything for Black people, but it has the distribution of crack pipes under their advanced racial equity funding, that looks crazy.
It's just totally insanity, and it just shows how out of touch and, frankly, how nuts the Democrat Party. They're not even, like I said, they're not even the same party as 5 years ago. They're just totally left-wing, way out. Like, I'm ashamed to say I was ever a Democrat at this point.
Because you have... Joke. Yeah, and because you have this experience of being in a gang, getting out of a gang, there's so much concern about young people today falling through the cracks and what the pandemic has done to kids who weren't in school. Globally, we know a lot of cartels have used this as a way to recruit kids.
So it's having a devastating effect for the kids and emotions, and also the gangs are right there just recruiting terribly. Like, yes, it is very bad. And not only that, all the drugs coming over through the border and all of that, that's the main supplier to all the gangs.
Jesse, we're out of time, but